Welcome back to my channel here. And right now it's February 7th, actually. And you know what that means? The Winter Olympics has started in Milan, Cortina, Italy. So that's pretty exciting. I always like uh, the Olympics and watching, especially the Winter Olympics. We've got a lot of cool, exciting events. We've got ice hockey and curling, ice skating, of course, is really popular, skiing, slaloming, all that stuff. Bobsled is always kind of fun. And of course, you've got ski jumping as well. And so the Olympics are starting, they're underway. There's a lot of cool stuff. But of course, this year, of course, the ski jumping is not without controversy. And so this year, the controversy gets a little bit interesting. The German magazine Bild, and I'll just kind of put this article. Now, this is an English translation of the article I'm going to put up, but I'll just kind of let you read that. So there's a little bit of controversy. Um, yeah, can you imagine why are ski jumpers, Olympic ski jumpers, apparently they're injecting hyaluronic acid into their penis? And so why are they doing that? Because that sounds completely crazy. And of course, yeah, because of the um, the headline that has everybody's attention, of course, right? So why are we doing this? Now, first of all, let's just kind of answer the question of what exactly hyaluronic acid is. Is this a drug? What is it? So hyaluronic acid is not really a drug. It's actually a carbohydrate. It's a polysaccharide. And hyaluronic acid is an anionic, non-sulfated glycosaminoglycan. And this is distributed very widely throughout the body. It's in our connective tissue, our epithelial tissue, even neural tissues. It's even in the eye as well, too. And it's fairly unique among glycosaminoglycans because it's non-sulfated and it forms in the plasma membrane as opposed to the Golgi apparatus. It also tends to be fairly large, and it can be about 20,000 disaccharide monomers. So structurally, it consists. It's of course a heteropolysaccharide, so that means that there's unlike amylose or starch, where your monomer is only glucose, you actually have two monosaccharides together in a disaccharide. So it's actually the monomer is a disaccharide. One of these is glucuronic acid, and the other is N-acetylglucosamine, right? And so then you got a nice long chain of these disaccharides. And it's also anionic, and it's a little bit more polar than glucose. That there's more polarity, and so what that means is that it binds to water even more than like starch, which is also very hydrophilic. So this sucks up water like there's no tomorrow, and so for that reason, it's a major component of proteoglycans. It actually forms the backbone of proteoglycans, where we can have like keratin sulfate and chondroitin sulfate kind of off the sides, forming little bristle brushes that also affect water. The hyaluronic acid is the backbone of this. And so it accepts more water. This gives it even more mass. And so we kind of bulk up, but it also provides a very important protective function in the body. And that's why it's found very commonly in most of our cartilage. So it is very important. It's something that is there. It's normal. As a drug, as far as doping agencies in the Olympics, there's no real rules about it. There's no there's no rules that you can't inject hyaluronic acid into really any part of the body, really. So the fact that maybe, and I'm not going to make a comment whether athletes are actually doing this or not. I guess that's an investigation that needs to take place. But it is, there's no rules against it right now. So it's also used medically as well, too. And so maybe some of the medical uses, let's just kind of think about why somebody might take hyaluronic acid medically. It's actually used as a common treatment for osteoarthritis. It may be injected directly into the joint as a viscose supplement. This will include lubrication and shock absorption. So that would help the pain of arthritis, especially near the bones. It's also used commonly in ophthalmic surgery, such as in cataracts and glaucoma surgery, as well as in cornea transplants. So this helps maintain the shape of the eye. It protects very delicate tissues, and it provides cushioning during surgery. It also plays a very important role in wound healing. So you could have injections or even topical applications that will treat chronic wounds or diabetic ulcers, or it could be used in surgical wound healing as well. And that's because hyaluronic acid will promote cell migration, and it supports extracellular matrix formation and even reduces inflammation. And it could even be used for soft tissue reconstruction as well. This could be for medical reasons or cosmetic reasons. So, for example, if you have facial lipoatrophy in HIV patients, it can be used to kind of bulk up different parts of the face, or even reconstruction surgery after a major trauma, or to correct congenital abnormalities. So those are all very common things. And of course, it can be used in urology and even gynecology. It can be used to stress urinary incontinence as a bulking agent, and for treatment of children, and even vaginal atrophy treatments as well too. So it acts as a volume restoring and cushioning agent. So it does increase mass, and it does kind of increase that surface area that I believe that maybe ski jumpers might be interested in as well. Now let's look at the structure of hyaluronic acid. And so I'm going to come over here and I'm going to go into PubChem, and we're going to just do a search for hyaluronic acid. Whoops. There we go. And so we come right up here. Now we see multiple molecular weights. Of course, the structure is just going to be the disaccharide that it's going to give you right here, right? And so the bottom one is your glucuronic acid, and because that's got a carboxylic acid here. And then the top one is your N-acetylglucosamine, because this is your N-acetyl group right over here, right? And then if we look at the 3D structure, now what I like to do is bring this up in Mo. So I'm going to copy the SMILES code, Control C, and then I'm going to go to Mo. This is our, whoops, I misspelled Mo. There we go. I need to bring up my 3D software. And we're going to come over to our builder and cut and paste the SMILES code right here. And we'll just call it HA. Give it a name right there, right? Now, anytime we bring up structure in here, we need to make sure and give it our force field. We'll just use our default force field quickly, and we're going to energy minimize. Now, before I energy minimize, at physiological pH, the carboxylic acid will be deprotonated because its pKa is generally pretty low. So we're going to deprotonate this just to make sure it's a little bit more physiological. Everything else should be fine, but we do want to deprotonate. And let's make the atoms a little bit easier to see. So we'll do that. And let's put the glucuronic acid on the left and the N-acetylglucosamine on the right. And then, of course, this is just the disaccharide. So then we kind of link, we kind of link over here to this carbon to the growing chain. Of course, we can have thousands additional molecules, right? Now, what I want to do next, of course, we need to energy minimize, so I'm going to go ahead and optimize the molecule. Wait a minute. Fixed charges. There we go. Did I? Oh, yeah, okay. And now we can optimize the molecule. So there we go. We actually have a hydrogen bond right in the middle that it optimized to. And now what I'm going to do is I'm going to put a surface map so we can look at what the surface, the electrostatic surface is. And so let's take a look there. Again, I'm just going to call this surface HA. And we'll do electrostatics. And we'll just do around the selected atoms right here. And okay, so that's solid. So let's make it a little translucent right here. There we go. So this is what hyaluronic acid is going to look like if we kind of see the bulk. So the van der Waals surface is kind of highlighted. And everywhere that it's colored in red is going to be a negative charge. And anywhere where this is colored in blue is going to be a positive charge. So you see this hydroxyl, you have a little bit of blue because that's the hydrogen bond. It's a partial positive charge in that case. And of course, the NH is also kind of in blue there. So we have a few hydrogen bonding things where it's blue. But we do have mostly red, and it's mostly anionic in nature. And so all of that, you know, these red areas and even some of the blue, this gives us an incredible ability to hydrogen bond with water. And if I have a long chain of this disaccharide, that means I can bond to more water. And then if I add keratin sulfate and chondroitin sulfate in a proteoglycan, then I can bind even more water, and all that water causes this to bulk up even more, right? So if we kind of look at the structure, that's what makes it ideal for its purpose as in our connective tissue and in our cartilage especially, right? Now, as far as the Olympics, they're injecting this, and of course it's a hydrophilic gel that they're injecting, and what they're doing, the reason they're injecting this is to add localized volume, and it retains water as well. It's not going to increase muscle power because it's not going to be associated with muscle, and it's not going to alter hormone levels, nor is it going to improve oxygen delivery. And it's not going to enhance neuromuscular coordination. So any of those muscle things, it's not going to bulk up muscle like steroid injections would do, right? So we don't have anything there. So really the advantage is purely mechanical. And so in theory, now I can't really find any peer-reviewed sources that suggest this will improve athletic performance injected anywhere, really. Again, there are medical reasons for injections of hyaluronic acid, but I can't really seem to find anything that supports the athletic claim. But it will change, the theory is it'll change the center of mass. And so extra mass, especially in the groin area of a ski lifter, will alter the athlete's center of mass and improve flight stability. Because essentially in ski jumping, what you want to do is turn the front of your body. You wear a specialized suit. And ski jumpers actually go through a 3D body scan with like skin tight underwear just so they can get the best fit. And they allow for about 2 to 4 centimeters of bulk in the suit. And so then they even measure the groin area. And so if they can increase the size, even the groin area, just, a centimeter or 2, then that gives them a little bit more surface area to kind of improve the aerodynamics as well. and even the theory, of course, well, the center of mass argument doesn't really make sense because let's just think about a ski jumper's body mass of 60 to 70 kilograms and just increasing the mass of the groin area. That's not going to make a difference in terms of your center of mass, because if you can increase the center of mass, you get more forward mass. That, in theory, will make you go forward, but the math just doesn't compute there. It just doesn't work. So we can kind of eliminate that. But the theory also is that you got a little bit more surface area, and so that increased volume will smooth the airflow and allow you to have better aerodynamics, so you can stay aloft a little bit longer and you can go a little bit further, right? They have done some airflow models, though, in ski jumping, and they show no benefit here. So that's just not working. It just doesn't matter. So, yeah, we're not helping anything there. Some people may believe it may help maintain posture or balance, and so the added bulk might have a proprioceptive feedback, and it kind of helps to stabilize that groin. The groin area can help stabilize things. If anything, it would probably be destabilizing with the extra mass. However, that doesn't exactly work. Now, there is one plausible benefit, though. And so the only thing, though, and this is still science, but there could be a plausible psychological effect. And so that's not complete nonsense, because there could be a placebo effect. And so the placebo effect doesn't really have any real pharmacological or physiological benefit, but it's all up in the brain, right? And so it'll give you increased confidence. It gives you that ability that I've done everything I can to increase and to increase my chances of success to get that gold medal. And so, that's psychological. I can go with that. And so, that this is definitely a possibility. Elite athletes, all they have to do is gain just a few centimeters could make the difference between a gold and a silver these days in the Olympics. So they want to make sure they're doing everything they possibly can to do that. Now, is this going to be turned out to be legal? I think the International Ski Jumping Federation is looking into this. Right now, there's no, it's not necessarily illegal, but we'll just see where that turns out. And it'll be an interesting controversy to watch. In the meantime, let's just go watch ski jumping, because ski jumping starts in Milan Cortina on Monday. So let's watch the ski jumping and see how they do, right? It's an interesting controversy. So I hope you found this video informative, and go ahead and hit the like button and subscribe to the channel if you want more content like this. And if you have any comments on this controversy or anything else, you have any questions, feel free to leave that in the comments below. So I always like seeing what kind of comments we get on these videos. So thank you for watching, and I'll see you again in the next video.